Hi guys, today I wanted to talk a little bit about obesity and weight management and how we as nurse practitioners can help patients with lifestyle changes and helping them overall be healthier. So obesity is an issue everywhere, but it is especially an issue in areas where access to affordable and healthy food is limited. So our job, like I said, is to help patients fix these issues and promote healthier lifestyles. What is a food desert? So a food desert is an area where access to healthy food is extremely limited. For example, I'm from a pretty rural town, very small town, and we don't have any healthy restaurants. It's all fast food. It's quick, it's easy, it's cheap, and a lot of times people want to do this instead of going out and buying groceries. Groceries are expensive. We don't have any buses or anything like that. There's not a lot of transportation here, so it's hard to actually get to the store for some people. So all of these things, all these barriers, those make up a food desert. Typically also with fast food, it's a lot, like I said, it's a lot easier than healthy foods, a lot quicker, but it's also a lot more calorie dense. So um, they're a lot more high in sugar, fats, and sodium, which can lead to not only obesity, but they can also contribute to these chronic diseases like hypertension, diabetes, and heart disease that go along with obesity. So here we have a list of counties in southern Ohio that are food deserts. As you can see, Adams County, Gallia County, and Pike County all have higher obesity rates, significantly higher rates than the state average, which is 36. So um, typically places with like more resources, Columbus, Dayton, Cleveland, those have a lesser obesity rate just because there's a lot easier access to healthier foods. So, um, and with that being said, I do want to say that in food desert areas, the problem isn't just about food choices, it's about the environment that makes those poor food choices seem like they're the only option. And when people don't have access to healthier foods or resources to afford them, they're more likely to turn to fast food. So, with that being said, we as nurse practitioners need to educate our patients, help them with the lifestyle changes that they need and the interventions and resources that they may need to help them better their health. And it's not our job to just treat the symptoms of obesity, but also help them understand why they're dealing with these problems, address the social and environmental factors that contribute to it. So we can start by educating patients about nutrition, explaining which foods are healthier and why, helping them counsel them with lifestyle changes like exercise, telling them things that can fit their specific situation. Like, for example, access to healthier options may include frozen vegetables, things like beans, whole grains, and we can also help connect them to resources in the community, which we'll get a little bit more into in a minute. So in order to help the patient, we first need to understand them. So a comprehensive assessment is big here. So the first step, we need to understand their eating habits, their level of physical activity, and their social habits. Do they drink? Do they smoke? Things like that. And also if they have any family history or health history of issues. Um, it's also important to be pretty sensitive about this stuff. We don't want to shame our patients. We just want to gather the information that we need to help them make healthier choices. So we might ask them, what do you typically eat? How often do you exercise? And do you feel like you have a good support system at home? So the more that we understand their challenges, the more that we can better equip them to make changes. As I've said before, pricey groceries, lots of fast food, not a lot of healthy options, lack of transportation. These are all things that can cause barriers to patients and food desert areas. So we need to really figure out which of these are affecting the patients in order to help figure out how to solve them. So healthy eating on a budget. We have plenty of options. Frozen foods, canned vegetables with low sodium. These are both great alternatives they're a lot less expensive than fresh fruits and vegetables, and they have a longer shelf life. Air frying. I love fried foods. I love French fries, all that stuff, but air frying has less oil, so you can still have the food that you like, but it's a little bit healthier. And then, of course, couponing is always an option. Figuring out items that are on sale, this can help with budgeting as well. As far as community support goes, we as nurse practitioners can do referrals to social workers, which would then help patients with their needs a little bit further. Some communities have food banks, they have farmers markets, and they have government programs that can help people get affordable food. For example, the Supplemental Nutrition Assistance Program, or SNAP, as it's called, helps provide affordable food to families that need it. So that is always an option. But these things can really help us connect our patients to the resources they need. So, small changes for a big impact. In other words, we need to help patients make little sustainable changes that can really help with their health. We need to focus on what they can control. So, for example, if patients drink a lot of pop, we can tell them to maybe try drinking more water, drink some tea instead, things like that. Or we can suggest meals that use super affordable ingredients that can last a while. So making things like stir fry or chili that last a couple days with cheap ingredients. That's always an option. Portion control is another thing we can discuss. Sometimes people don't really realize how much they're eating, especially when it comes to fast food. So that's always something that you could go over with your patient. Physical activity with limited resources. So this really just depends on the patient. I know a lot of people, they may work 9 to 5, they may have children, so it might be hard for them to have time in their day to make for themselves to exercise. So we want to start small, maybe recommending 15 or 20 minutes of exercise, of walking, and then gradually building their way up over time, something a little bit more strenuous, because exercise does help with the weight loss, weight management, but it also just makes you feel good. When medication is needed. So as nurse practitioners, it is our job to differentiate when lifestyle changes aren't cutting it and when it's time to look into maybe some weight loss medication, a referral for bariatric surgery, things like that. Especially in the case of people with diabetes or hypertension, medication may be needed to manage these things. But I do kind of want to note that while medications can help, they're not the only solution, and they're also not super a long-term solution. So lifestyle changes are typically our first line for long-term health. Mental health support. So this is another big one. Living in a food desert especially can cause stress, anxiety, depression, which can all make it a little bit harder to focus on health. Not to mention patients may be struggling with some trauma with life events they've had, financial struggles, things like that. So we need to be able to figure out what's going on and help them, whether it be counseling or referring them for cognitive behavioral therapy. We also need to see what their support network is at home. With all of this being said, we as nurse practitioners can help our patients manage obesity. Even though it might be a little bit challenging, it's definitely not impossible. So it might take time, patience, and some creativity, but we can focus on small, manageable changes, and building up a strong rapport with our patients to help them overcome their barriers and overall have a healthier life. Thank you guys.